Hi, good day. My name is Ushin Walker. Today's date is November 15th and the time is 12 p.m. I'm here today to do an NG tube insertion and removal. So before entering my patient's room, I got all the supplies that I would need for the procedure. Entering my patient's room, I'll create privacy. Wash my hands. Introduce myself to my patient. Hi, my name is Ushin Walker, your nursing student today, and I will be here to do a NG tube insertion. Can I have your name? And I will check the patient's armband to make sure the name and date of birth correspond with what I have and make sure that the patient verbalizes that to me as well. So I will set my patient in the correct position. Make sure he's in a high fullest position. Right? I would start setting up all the things I would need. So first I would do my tape. I will need 4 pieces of tape. So the last piece of the tape, I would then split it in half. That will be placed on the patient's upper nose. I already have my lubricant onto my washcloth right here, so I will set this right here. Wash my hands again. Put my clean gloves on because this is a clean procedure, not a sterile procedure. I will then go over to the patient to assess his breathing to make sure which nose he's breathing properly through. So that's the nose we will enter through. So I'll hold this part and ask him to breathe out. Hold this one and ask him to breathe out. So he's breathing more properly on his right side. So we'll insert through his right nostril. I would then take my NG tube and measure it by placing it at the tip of the nose to the ears and all the way down, just a little past the xiphoid process. I'll put one of the tape around that just to mark it so I don't go past that. I'll make sure I have my pen light in reach so that I would check to make sure that the cord doesn't coil at the back of the patient's mouth. So now I'm gonna get my stethoscope just to put it on my neck to have it ready. I'm gonna have my syringe ready. Pull up 30 cc's of air. Attach it to the end of my NG tube. Lubricate my tip, the tip of the NG tube well. And while inserting the tube, I'm gonna make sure that my patient has sips of water to help the tube go down easily. So I have my jug with my water. Now I'm gonna have a nursing student assist me with the process. So while entering, I'm gonna make sure the patient aware that I'm entering. Carefully enter while you taking sips. Once I reach the back of the throat, I'm gonna use my pen light just to make sure it's not coiled. Taking careful sips. Extend this head forward while I carefully walk my fingers. Place a tube in. At this point, like are in a real life setting, the patient may be coughing or anything at this point, and typically we'll have like a towel over the chest to collect any secretions. So after I've reached my margin, I would then start placing the tape on my patient. Wrap this around this corner. then I'm gonna carefully place this one above across the nose to secure this one. Okay, so after that is secured, I put my stethoscope in, insert my 30 cc's of air, making certain that I hear the swishing sound. Detach my syringe carefully, not to make any secretions spill. So now I'm going to aspirate to test the pH of the secretions in my patient's GI system. I'm gonna aspirate up until like 10 milliliters, 10 cc's. Carefully remove it, close it, and then I will test it with my pH thing right here to make sure that it is in the correct range. I will then put it in this vomiting basin right here, and then I would make sure I secure this on my patient's gown. Normally there will be a safety pin on the patient's gown, but in this setting we don't have one, so I would just use a tape to secure the tube on my patient's gown. So that is my video for inserting an NG tube. So now I'm going to remove my patient's NG tube. I'm going to make sure that I create privacy, put my patient in the right position, and have on clean gloves. I would then put a towel over my patient's chest area just to catch any secretions coming out. I would then assess my patient to make sure that, he's comfortable and not in any pain before I start the procedure. I would then check my patient's name and date of birth to make sure it's the right patient. Make sure he verbalized that to me also. And then I will start by releasing these tapes. And also the tape on his clothes that secures the tube. Then I will tell the patient that I'm going to take the tube out and then carefully, 1, 2, 3, carefully walk it through, wrap it in the towel. Then I will go to the bin and throw the tube inside of the bin and put the towel into the laundry basket. So that is my video on how to remove an NG tube. After removing the NG tube, I would then document when my patient tolerated the procedure, document if my patient was in any pain or anything, document and describe the secretions that came out, the color, odor, or if they need any specimen at the lab, then I would do that also. Thank you.